Heat and cold therapy. We treat everything from arthritis to muscle soreness to inflammation with ice packs or heating pads. Topical application of ice or heat can bring a surprising level of pain relief for most types of back pain. But the tricky part is knowing what situation calls for hot and which calls for cold. Sometimes it includes both. As general rule of thumb, use ice for acute injuries or pain, along with inflammation and swelling. Use heat for muscle pain or stiffness. Cold therapy. How it works? It helps improving the reduced blood flow to an injured area. This slows the rate of inflammation and reduces the risk of swelling and tissue damage. Acts as a local anesthetic. It slows down the pain messages being transmitted to the brain. Helps treat a swollen and inflamed joint or muscle. It is most effective within 48 hours of an injury. Homemade ice pack. A frozen towel. To make a towel into a cold pack, place a folded, damp towel in a plastic bag and put it in the freezer for 10 to 20 minutes. Then take the towel out of the bag and place it on the affected area. Sponge. Wet a sponge and put in the freezer. After it is frozen, take it out and put it in a baggie, then wrap it in a sock or a towel before applying it to the sore back. Rice. Another alternative is to fill a sock with rice and place it in the freezer, as rice will get as cold as ice but does not melt when used. Gel-type pack. Still another alternative is to fill a bag with liquid dishwasher detergent and freeze it, which gives it a consistency of a gel pack. Frozen bag of peas. If ice is needed quickly, it is easy to grab a bag of frozen peas or other vegetables out of the freezer, wrap it in a towel and apply it to the painful area. Steps to make homemade ice pack at home. Place ice cubes in a big bowl and put some cold water in it. You can put some herbs like oregano, mint, lemon juice and vinegar to the water for pain relief. Take a washcloth or hand towel, and dip it in the ice-cold water. Now squeeze the towel with your hands to drain excess water. Place the homemade compress on your skin for up to 15 minutes. Dry the area with a towel after you're done. Reapply. For swelling, reapply the compress after 2 hours. How can you use ice? A cold compress should be applied to the inflamed area for 20 minutes every 4 to 6 hours for 3 days. Massaging the area with an ice cube or an ice pack in a circular motion from 2 to 5 times a day, for a maximum of 5 minutes only, to avoid ice burns. Helpful during the first 48 hours following an injury or stress that strains the muscles. Always check the area every 5 minutes to avoid ice burns. 13. 1. 2. When not to use ice. If there is an open wound or blistered skin. If you have vascular disease or injury. Hypersensitive to cold. Should not be applied directly to skin or bones as can lead to frostbite. Heat therapy. How it works? Warm is the proper temperature. It should be between 76 to 82 Celsius. Improve circulation and blood flow to a particular area due to increased temperature. Relax and soothe muscles and heal damaged tissue. Increases flexibility. Homemade heat packs. Hot water bottle. Tends to stay warm for 20 to 30 minutes. Electric heating pad. Maintains a constant level of heat if it is plugged in. Warming or heated blanket which could be wrapped around. Commercial adhesive wrap that sticks to the back and provides several hours of low-level heat. Fill a sock with rice and heat it in a microwave. Moist hot towel can be used for moist heat. How can you use heat? The duration that one needs to apply the heat is based on the type of an or magnitude of injury. 4. Very minor back tension. Short amount of heat therapy may be sufficient, such as 15 to 20 minutes. For intense injuries, longer sessions of low level of heat may be more beneficial, such as 30 minutes to 2 hours or more. Applied to head and forehead, which reduces spasms and relieves headache. If you are diabetic or having any underlying skin conditions, always check after every 5 minutes for burns. How to prepare hot pack with a towel. 1. Fill the bowl with water that feels hot, but not scalding, to the touch. 2. You can put some herbs like oregano, mint, 2 teaspoons of salt, freshly squeezed lemon and 2 teaspoons of vinegar. 3. Soak the towel in the hot water, wringing out the excess. 4. Fold the towel into a square and apply it to the area that's in pain. 5. Hold the towel to your skin for up to 20 minutes at a time. 14. 3. 4. 8. 5. 6. 7. 1. 2. 3. 4. 8. 5. 6. When not to use heat. If you have swelling or bruises on the area to be applied. Diabetes, as the skin becomes more sensitive and there is chance of getting burns. Check at regular interval for burns in this case. Open wound. Vascular conditions. Contrast bath. Contrast bath therapy is a physical therapy treatment in which all or part of the body is immersed first in hot water, then in ice water, and then the procedure of alternating hot and cold is repeated several times. The contrast bath can help improve circulation around your injured tissue. This is one of many whirlpool treatments physical therapists use to help decrease pain and muscle spasm, increase range of motion and strength, and improve functional mobility. Goals of treatment. The goals of treatment will most likely include decreased pain, decreased swelling, controlled inflammation, improved mobility, How does contrast bath therapy work? The key to contrast bath therapy is in the rapid changes produced in your circulatory system when you go from very warm water to very cold water. When you submerge part or all of your body in cold water, small blood vessels called capillaries respond to the cold by getting smaller. This is known as vasoconstriction. When you immerse yourself in warm water, the opposite happens. Your blood vessels open up. This is known as vasodilation. This rapid opening and closing of blood vessels near the site of your injury creates a pumping action that's thought to help decrease swelling and inflammation around injuries. Decreasing the swelling and inflammation helps alleviate pain and improve mobility. How contrast bath therapy is administered. To perform a contrast bath, you need 2 tubs. 1 tub should be filled with warm water and 1 tub with cold. The warm tub should be between 98 to 110 degrees Fahrenheit, and the cold tub should be 5060 degrees Fahrenheit. Once both tubs are the correct temperature, you have to place your injured body part. 15, 11, 12. In the warm tub first, where it should stay for 3 to 4 minutes. You can do gentle motion exercises during that time. You'll then quickly move the part being treated to the cold tub or bucket. Typically, you'll stay in the cold water for about 1 minute. The sequence of moving from warm to cold and back again is generally repeated for 20 to 30 minutes. Contrasting should follow the following basic pattern: 3 to 6 alternations between heating and cooling. About 2 minutes of heating, comfortably hot. About 1 minute of cooling, cool, not cold. About 2 minutes of heating, hotter. About 1 minute of cooling, colder. About 2 minutes of heating, hot as you can handle. About 1 minute of cooling, cold as you can handle. A few tips and rules of thumb for contrast bathing. Stay warm. You generally want to be more thorough with your heat, at least a minute, but if 5 minutes depending on how efficient your heating method is. Heat is more comforting and relaxing than cooling, obviously, and inadequate heating is the most common thing people do wrong with contrasting. Finish with cold. You should usually finish a contrast session with cold, particularly if you suspect that you might be a little inflamed. Never finish with heat if you're concerned about aggravating inflammation. You might choose to finish with heat if your priority is to have a more relaxing experience. Stretch when hot. If you choose to stretch, do it after or even during the heating. Tips to combine heat and cold therapy in daily routine. Keep a heat patch near your bed and use it first thing in the morning to warm up your muscles if you wake up with an achy or stiff back. Apply a cold patch before bed if you have exerted your back. Use heat therapy after and before sleep if suffering from chronic pain. Carry a couple of self-activating heat patches and ice packs in your bag or car while driving or at work. 1.